Nurses and doctors of Reddit, what is your back quote they never taught this in school moment? This one was fun. Patient in ER gets a standard urine drug scrap positive for ethanol alcohol. Patient insists he does not drink alcohol. Test is repeated. Positive. Patient is very upset. He does not drink alcohol. Blood test is drawn. It's negative. We checked everything we could think of. Did we have the right urine? The right blood? It should be impossible to test positive on urine and negative on blood. Meanwhile, I finish his regular urinalysis. High white blood cell count, and really high glucose. Elevated white cells means you need to look at it under the microscope, because they probably have an infection. It's loaded with yeast. The man was diabetic, obviously, and had high glucose sugar in his urine, along with a yeast infection of the bladder. The yeast was fermenting the glucose to ethanol within his bladder. He was the man who peed beer. I was in my first year out of family practice residency. The specialists like to sneeringly refer to us as jack of all trades / master of none. I was on call from the ER. A normally unshakable ER doc was beside himself. Had a very preterm mom in active labor. And fog wouldn't let us fly her out. He was the only ER doc and the transferring facility wouldn't take her in transport without a physician on board, probably not legal, but we needed her to be at a hospital with an ICU and L&D, so they called me. En route I was trying to coach her to breath through the contractions, but she felt something coming out. I looked and saw a foot. So we're in the back of an ambulance delivering a footling breech preemie. We delivered about a minute or two out of the hospital. They were expecting a mom in preterm labor, not a macro preemie. We were met in the ambulance bay by one nurse. She took a look at me holding the baby with a blanket and oxygen, and said follow me. We ran through the hospital to L&D, and turned on an incubator. Peds wasn't in house and the baby's heart rate was low. So I proceeded to intubate her. That was 12 years ago. She survived and is doing great. I wrote my program director at 4 AM that morning, when I got back home, thanking him for all the training. I think I used 100% of my training that night. But my GF, walking into a patient's house home health and almost being knocked unconscious by the smell of cat piss. The lady housed 25 feral cats, but didn't let them outside, because she was afraid the coyotes would eat them. Walked into a trailer house connected to a camper, only to see the floor start moving. Realized it was sea croaches, not the actual floor. A patient being treated for HIV purposefully tried exposing staff members to his fluids. That was a sobering experience. Nurse here. A very panicked nursing assistant came running to the desk one day saying, "You have to come see this." I don't know what this is. The NA brought me into a patient's room, where she was giving a bath and points to an area on the patient's buttocks. What is that? I lean in for a closer inspection, when the patient starts to turn back around and says, "Is that my eye?" Sure enough, I didn't receive in report that my patient had a prosthetic eye which at some point came out of the socket and became suction cupped to her buttock. I left the room and had never laughed so hard in my life. Nearing completion of an air contrast barium enema on an extremely elderly patient. Out of nowhere she starts saying call Rochester Funeral Home. "I'm dead, call Rochester Funeral Home, I'm dead." She repeated it no less than 10 times. Took care of a young man with a gunshot wound to the abdomen. He had many complications. He was in the hospital for over a year. He had an ostomy bag for a while, but when they finally removed it, he was so nervous because he hadn't pooped in so long. His call light goes off and he says, "Go look in the toilet. You're never going to believe this." I go in there and there is poop in the toilet. His first solid poop I had seen in over a year. I walked out and gave him the biggest hug. He was so proud of his poop. I walked out of his room with tears in my eyes. Nursing school never prepared me for crying outside of a patient's room because I was so happy they had pooped. Edit. Thank you kind strangers for all the silver and gold. It warms my heart to know this comment made you smile and was relatable to some of you. Good luck to those who are on their own ostomy journey. It stinks literally, but always keep hope. And always remember, it's the little things. A grateful peds nurse. When my mum was fresh out of nursing school in the ATS, she got a job at a hospital that had a high concentration of geriatric patients. One particularly frail man took out his dentures before sleeping, then passed away in the night during her shift. His cheeks were so alarmingly sunken in. My mum and another nurse tried to put them back in so as not to horrify the family. However, rigor mortis had already started to set in. She said nursing school definitely didn't prep her for that nightmare. I teach post-mortem care to other CNAs at my hospital, since I'm particularly passionate about it. The family may want to hang with the deceased for a long time. So I always stress to put the person in a nice position at the earliest time feasible. Don't leave grandpa crooked on the pillow or he'll get stuck like that. Make sure his arms aren't in a strange position. ECT. But they always call me when it's time to tag and bag talking about how he's stuck. He should be. Edit. Wow. Thanks for my first silver and my highest rated comment. Wow. So many things. I think one important thing that was never taught is how to deal with a patient dying for the first time. I couldn't stop picturing his last breaths, the yelling of his family, all of it played through over and over. Hospice is tough, but it still is one of my favorite jobs I've ever done. How to put a fake eye back in. A patient came in from a not so nice nursing home with a multitude of problems, one of which was a disgusting, draining fake eye that had to be removed for treatment. Upon discharge, we had to put it back in. Simple enough we thought. But we had no idea how and struggled to figure it out. I suppose that is why the nursing home staff never took it out to clean it. This was decades ago. Fake eye technology is probably much better today. How to react when a patient's bowels pop out of their incision. This happened when I was a brand new nurse, but off orientation. Quite a learning experience, but came in handy because a few years later it happened to a different patient, and I knew what to do. You have to keep the bowels very moist, cover with sterile gauze, and patient is rushed to the AskReddit. I'm glad this was taught to some of you in school. I remember learning about it, but never learning what to do if it happened to a patient. When I was a student I accidentally degloved a patient from the elbow down. They were incredibly sick, probably already brain dead, and had one of the worst case of 10/toxic epidermal necrolysis I've ever seen. Anyway, I'm in there holding this lady's inside out arm skin like an idiot, with the family standing in the corner horrified, and I just froze. My first thought was to kind of slide it back on, but thankfully one of the senior nurses rescued me and snipped that shoot off. Women will pee and poop during labor. Ribs crack during CPR, and it feels really weird. There is a market for amoxicillin amongst fourth drug users according to my patients. It's very common for somebody else to put cocaine in their urine, and fentanyl is a sexually transmitted drug. Respiratory therapist here. How to act when we unplug the ventilator to let go a patient, especially when the family is around. To their defense, they do warn us it's going to happen, but it's never until you actually do it that you realize the weight. I like to talk to my patients, even if most are already brain dead at this point. Although I did have to unplug conscious patients, that was hardcore to say the least. This gives me a sense that at least, if even a small part of their consciousness is still alive at this point, they know they're not alone. I tell myself that at least from now on they won't be suffering anymore. Student nurse here. How to hide looks of shock when something very surprising or awkward occurs. I remember one time a doctor grabbed me when I was in the hall to hold something for him while he was putting a patient's prolapsed rectum back in. Awkward. When I was a med student, we had a patient with rectal prolapse and the charge nurse said only a doctor was allowed to push it back in, something about this being a procedure with risk of perforation. Sure. Anyways, cue the intern, resident, and myself googling how to push a prolapsed rectum in. My job that day was to find sugar packets, because apparently if you can't just push it in, you sprinkle it with sugar and try again. Not something they taught us during the preclinical years, and obviously the intern and resident hadn't learned it in med school either. They never really tell you how to cope with being berated by family members, patients, and even co-workers. Part of being a nurse means that you realize you are dealing with people at their most vulnerable, at the worst time in their lives. And you know this in the back of your head. But being an emotional and sometimes physical punching bag for days at a time requires a certain mental toughness that you can never really prepare for. I heard this story from a SLP. Always keep a clear exit. She was working with a stroke survivor, set her at the workspace. and walked around to the back of the table with her back against the wall and facing the door. Suddenly the little lady says, "I know who you are. You're the lady who has been sleeping with my husband." Suddenly this lady has lunged across the table and is legitimately trying to kill the SLP. Luckily lots of other people came when she screamed code blue. She couldn't think of anything else at the moment. From former boss, how someone looks at you when he tests positive for HIV after his wife died of AIDS because you were her doctor and you treated her for years. You were also his doctor, you knew she hadn't told him, and you knew that she was still having unprotected sex with him. On behalf of my husband, no one tells you how many low-income women will go to the complain of abdominal pain, go through an exam, and have different tests ordered because they can't afford a home pregnancy test. I was never taught about sundown syndrome until I was working with the elderly in a hospital setting as a student nurse. I had the sweetest elderly patient in my care until about 4 PM that day, he suddenly became possessed. He started screaming and hallucinating, and was not the man I had been providing care for earlier. I was so befuddled when the nurse I was shadowing told me he had sundowners and explained it to me. Number 1 most memorable, cardiac massage for 10 straight minutes while a guy was bleeding to death from multiple gunshot wounds. Had to stick my fist up those Simone's left lung to locate the heart and to directly give them CPR. Literally pumping this dude's heart so it can keep circulating blood. Felt like I was doing a fatality move in Mortal Kombat. It was surprisingly small and very squishy. They never teach you to expect the unexpected. I got floated to the ICU on a slow day. They immediately gave me a patient who was violently hemorrhaging out of his mouth, while all of family was inside freaking out with me. He died an hour later. Had 2 different patients come in with thighs big kitchen knives deeply embedded in an eye socket. They were both awake and talking. Enema parties are a thing. Inflatable penis implant surgery is pretty shocking but also amazing. Opening up a tumor/cyst to find fully grown teeth and hair inside of it. The day a patient exploded in surgery and it splattered the entire OR team and room with this brown fluid. There's an alarming number of nurses and doctors who don't know what the frick they're doing. I've learned so much more, but those are what I can immediately recall. Edit. Left lung. The heart is on your left side of the body, unless you have dextrocardia. Patients having sex and or shooting up in the bathrooms. People coming in odd and then bouncing out the door as soon as they are conscious to come in odd again a day or 2 later. Then repeating the cycle every week or 2, but somehow never dying. Patients who fake symptoms to get admitted for attention or to get a day off work, or get hopped up on goofballs, or whatever thing they are after. Delirious old ladies telling me to get out of their living room or they will shoot me. Any kind of self-harm. Patients coming in next to dead because they've been neglected in the prison system. Book world and real life nurse world is completely different. I'll play along. They never teach you that your psychotic/dementia patients will try to hit you. They don't teach you how to react, or don't to a patient or family member or physician yelling at you. As a sonographer, I have to keep a poker face a lot of times when I'm seeing something very alarming or sad on the screen. Luckily, most people have no idea what I'm looking at, so that's a plus. I'm not allowed to give any results to patients. Doctors deliver the bad news, so I have to stay neutral. It's really hard. Had a patient with horrendous teeth issues. A couple of teeth fell out during intubation, so they sent him up with them in a denture cup. That was a real awkward conversation when he woke up. Anytime there's something up the butt. That time 100-year-old grandma broke her hip falling out of bed. But not her bed. On a more serious note, the "your loved one is dead" phone calls. This is usually done by the doctors, as I feel it should be, but sometimes nurses do it. RN here. For me, the most surprising thing has been seeing firsthand how peaceful it is for a patient to be able to choose when and how they will die. I was present for the first medical assisted suicide on my unit. The patient had his loved ones surrounding him, and we all watched as he said goodbye and shortly after took his last breath. In my area of nursing, patients get better and go home. I always viewed my work as a means to make people better. It has taken me a while to process his decision. It was beautiful and peaceful, and really made me look at nursing in a different way. I care for people to help them live, but for this man I was able to support him through death. EMT here. Sorry to intrude. They teach you how to handle death. They tell you, you're going to have dead patients. You're going to see the ugly side of death that doctors and nurses don't have to see, because when they get the patient, most of the ugly is handled by you. So we need thick skin. But when you have to hold the hand of a kid less than 10 years old who says I don't want to die, and next watch him slide into a no waking up sleep, it's freaking life changing. FCK me. I didn't want to cry tonight. Enough Reddit for today. Sexually harassed by an elderly patient. The guy's 80 and frail. Was I grossed out? Yes. Was I threatened? No. But they don't teach us how to respond to impotent harassment from hospitalized patients. Do I get a new doctor for him? What if that doctor is a woman too? Should I put up with it? I treat rude abusive assholes every day. Why would this be any different? Still trying to figure out what I should do. As a nurse's aide we are just supposed to say I'll get the nurse for you when you get a real stumper. But when a dying patient or their family member cries to you, they don't want to die. You can't get someone else to help them. You have to find the exact words to find in the middle of serving dinner and 5 call bells ringing off your hip. Probably the hardest situation in palliative work. My mother was a nurse who cared for elderly patients in a very rural part of England. Here's a few her favorite stories. One was a lady who decided to help clean the windows. She used the food from her dinner as soap and napkins. There was a fun mess to clean up. Another was 3 gentlemen who spent the night calling out for their wives. One was named Edie, one was named Emma, the other was named Elspeth. She said that was one of the longest shifts ever. Finally, she said most of the elderly men were completely clueless when it came to ordering their dinners. They would always say something along the lines of "that's my wife's job." She used to just order them the basic meat and 2 veg option, and rarely got complaints. Whatever your granddad would like usually was the safest bet. My grandfather was a farmer. They never teach nurses how to express/manage expressions in unexpected or poor situations. I personally have no trouble hiding everything, but watching people around me and the people patients themselves tend to ask me what's wrong with that nurse/doctor. Me being able to keep such a straight/relaxed face and expression helps everyone around normally. Being able to explain something bad without a panicked expression is an invaluable skill, which can definitely be learned/taught, though nothing can prepare you for some situations. I can say I can't remain relaxed when I see a high-risk person self-remove a trash tube. When your patient has a chute the size and shape of a football stuck in their butt, and you have to use your finger to delicately scoop it out. When the doctor comes along and tells your patient they are dying of cancer, then walks away and leaves you to pick up the pieces. When your patient is 90 years old, has dementia, diabetes, cancer and comes to hospital with pneumonia. They are 30 kilograms soaking wet, nothing but a bag of bones who doesn't recognize themselves in the mirror, yet their family insists they are for CPR. What to do if a gang member comes into your ward and shoots your patient who is a rival gang member? That was a nightmare. 4 shots at point blank range and even then one of the bullets hit the overbed table instead. It freaked me out that you could still hear the bullet rattling around inside it whenever you moved it. I quit nursing soon after and went into it instead. One of my favorite stories to tell is how you get lulled by the complaint in the chart. Earache is 10 million ear infections and the occasional sea roach. So the complaint is rectal pain. I immediately think hemorrhoid perirectal abscess or a fissure. So I see Mr. Rectal Pain. Gentleman tells me he has rectal pain and literally no other symptoms. I get to the part of examining his anus and there is a normal looking anus. So we should do a rectal exam. I digitally examined his rectum and instantly say ow, there's something sharp in there. Out comes a fishbone. It was big too, like 2-3 centimeter fishbone. I asked the patient about it and he's like, oh, I had red snapper a few nights ago. In the specimen cup it goes and me parading through the emergency department showing everyone what I just fished out of some guy's asshole. I shoot you not. I tell this story to my colleague and he proceeded to tell me how in his residency they did rectals on all trauma patients. One time one of his fellow residents goes to do a rectal on a trauma patient and said the same phrase, "Ow, there's something sharp in there." Instead of a fishbone it was a hypodermic needle.